We are covering the critical topic of benefit triggers for long-term care policies on your health insurance exam. This is a frequently tested area, and the exam questions are designed to be very specific. To qualify for benefits under a tax-qualified long-term care policy, an insured individual must meet one of two triggers. The first and most common is being unable to perform a specific number of activities of daily living without substantial assistance. The second trigger is the presence of a severe cognitive impairment. Let's break down the first trigger, as this is where most exam questions live. The activities of daily living, or ADLs, are the fundamental tasks of self-care. The magic number you must remember for the exam is 2. The insured must be unable to perform at least 2 of the 6 specified ADLs, not 1, not 3, but 2. The 6 ADLs are bathing, dressing, toileting, transferring, continence, and eating. A common exam trap is to present a scenario with activities that sound like they should qualify but don't. The exam will try to trick you with what are known as instrumental activities of daily living, or IADLs. These include tasks like cooking, cleaning, shopping, managing finances, or taking medications. While important for independent living, the inability to perform an IADL does not trigger long-term care benefits. For example, the question might state that an insured can no longer cook their own meals or drive to the grocery store, but can still bathe and dress themselves. In this case, they would not qualify for benefits based on the ADL trigger. To help you remember the 6 official ADLs, use the mnemonic TEDS BC. That's TED''S BC. This stands for toileting, eating, dressing, sphering for transferring, bathing, and continence. Transferring specifically means moving in and out of a bed, chair, or wheelchair, while continence refers to the ability to maintain control of bowel and bladder function. The second benefit trigger is severe cognitive impairment. This is your OR condition. An individual can qualify for benefits even if they are physically capable of performing all 6 ADLs. This trigger covers conditions like Alzheimer's disease or other forms of dementia. The key here is that the individual requires substantial supervision to protect their own health and safety. An exam question might describe a person who can dress and feed themselves but wanders off and gets lost, clearly indicating a need for supervision due to cognitive decline. This person would qualify for benefits. Finally, regardless of which trigger is met, the condition must be certified by a licensed healthcare practitioner. This certification must state that the inability to perform ADLs or the cognitive impairment is expected to last for a period of at least 90 days. The exam won't get into the specifics of which practitioners, but you need to know that professional certification is a requirement, not just a family member's opinion. So, remember the magic number 2 of 6 ADLs. Know the specific list using TEDS BC. Watch out for IADLs as distractors. And understand that severe cognitive impairment is an alternative trigger that also qualifies an individual for benefits once certified. For free practice questions, AI-powered explanations, and more exam prep tools, visit openexamprep.com. That's openexamprep, all one word, .com.